I bet you have not given very much thought to blood sugar and how it's affecting your fertility, but the truth is blood sugar level and blood sugar dysregulation in women as well as men is a deep impact to fertility, hormonal health, and even pregnancy outcomes. So, if you have been dealing with fertility issues, struggling to conceive, or suffering from recurrent pregnancy loss, this episode is going to be for you. Hey, powerhouse women! Welcome back to my channel, and where we're talking about optimizing fertility with even a busy, career-driven life. Yes, you can have your cake and eat it too. I'm Dr. Omatma, and today we're talking about something that affects almost every aspect of your health, especially your fertility: blood sugar dysregulation. If you've been struggling to conceive, blood sugar imbalances could be the root cause of your fertility challenges. Let's break it down and explore why managing your blood sugar can be a game changer on your fertility journey. First, let's talk about what blood sugar dysregulation actually means. Your blood sugar levels rise and fall depending on what you eat, how often you eat, and how your body processes that food. Normally, your body maintains balanced blood sugar levels through the hormone called insulin and the other hormone called leptin, which insulin helps to remove sugar from your blood into the cells and turns it into energy, while leptin tells your body you're hungry and helps you have that hunger signal so that you can eat more food. However, when your blood sugar spikes too high or crashes too low, your body has to work extra hard to regulate it. Over time, this can lead to insulin resistance, where your cells become less responsive to insulin. This is not only going to affect your energy levels and metabolism, but it plays a critical role in hormones. And that's where fertility comes in. So, how does blood sugar dysregulation impact female fertility? Hormone imbalances. When your blood sugar is out of balance, it triggers a cascade of hormone disruptions. High insulin levels, for example, lead to elevated testosterone in women, and elevated testosterone can lead to high insulin. So there's a feedback loop, and this feedback loop can often dysregulate or disrupt ovulation and can lead to conditions like PCOS, which is one of the common causes of infertility. The second loop that we should be concerned about is when your blood sugar is too low and it stays too low, it often will trigger a release of cortisol. So now you may feel like you're not stressed, but your body just released all of this cortisol in an attempt to get your cells to release some of that sugar back into the bloodstream to stabilize your blood sugar. So when you're doing things like skipping meals, which I am the queen of, and because I'm busy, I often tend to skip meals, and I've noticed that even though my blood sugar and specifically my hemoglobin A1C is 4.9, which is great, except I am often in a low blood sugar state, and my body is driven to release cortisol, which actually has a very detrimental effect on my hormonal system. So, if you're like me, please take my advice and eat regular meals. This is the saving grace of someone like me who tends to be super busy, stuck in meetings often, and leaves her lunch break on the side to work. So, please don't be like me. Please start eating. And I've made a commitment to myself that for the next year, I will be doing the same. I'm going to be eating regular meals at regular times so that I can keep my blood sugar level and not have these deep crashes that cause this release of cortisol, which is really wiring me out, stressing me out, and causing aging, which I do not need. All right. Blood sugar imbalances can also throw off your menstrual cycle, making ovulation irregular or even absent. A lot of women do have regular cycles where they're not ovulating. So, can you have anovulatory cycles but still have a regular period? Unfortunately, yes, you can. And without regular ovulation, it's so hard to conceive. So, make sure you're not having blood sugar impact your menstrual cycles. Poor egg quality. Insulin resistance and chronic blood sugar imbalance can impair the development of high quality eggs. Studies show that women who have blood sugar imbalances or dysregulation can often produce fewer viable eggs, which reduces the chances of conception. This also applies to you if you're doing an IVF cycle where you want the best quality of eggs possible. If you are not eating regular meals, your blood sugar is dysregulated, or you have insulin resistance, all of those are going to affect how the quality of the eggs are that are retrieved from your body and how well they fertilize. So, if you're going through IVF or you're trying for natural conception, getting your blood sugar regulated is key. Women with uncontrolled blood sugar issues like prediabetes or diabetes are higher at risk of miscarriage due to a poor uterine environment and hormone instability. We've also seen that women with blood sugar dysregulation before they conceive are more likely to have gestational diabetes during pregnancy, which you absolutely do not want. This poses a high risk to your baby and can impact your pregnancy in deep way. Additionally, women who have blood sugar dysregulation, maybe they're not pre-diabetic or diabetic, but just have this mild insulin resistance, or someone like me who you can't even tell has blood sugar issues, but is obviously super dysregulated, is going to be, it is going to be super important to get someone to understand what's happening in your body and break it down, because honestly, it wasn't until I got a continuous glucose monitor, a CGM, that helped me see that I was having these really deep blood sugar crashes that I didn't even feel. But we know that that level of blood sugar crash causes cortisol spikes and increases the risk of potential pregnancy loss. Blood sugar imbalances don't just affect women, men's fertility is influenced by them as well. So let's talk about men and blood sugar imbalances. High blood sugar and insulin resistance can cause drops in testosterone level in men, which is going to affect sperm production. Low testosterone can lead to lower sperm counts as well as poor sperm quality. Blood sugar dysregulation increases oxidative stress in the body, which can cause sperm DNA damage. It leads to reduced sperm motility and morphology, making it harder for sperm to fertilize an egg. We also know that men who have prediabetes or diabetes are more likely to have damaged sperm that, even if they fertilize an egg, are going to be more likely to cause pregnancy loss in the female. So, women that have had recurrent pregnancy losses, you absolutely need to have your partner checked and assessed for blood sugar and insulin dysregulation, because these things on his side can be impacting your pregnancy outcome. Last but not least, erectile dysfunction. Chronic blood sugar levels that are high in men can lead to erectile dysfunction by damaging blood vessels and nerves, which then adds an additional challenge for couples that are trying to conceive. And let's face it, guys, ED is no fun. So if you are struggling with this, definitely make sure that your doctor checks you for your blood sugar as well as your insulin. As busy CEOs and entrepreneurs, we're constantly on the go, and our schedules don't always leave room for balanced meals or regular physical activity. But those two things combined together are crucial for maintaining optimal blood sugar regulation in our bodies. Here are some other reasons why you may be higher at risk for blood sugar imbalance. We've already talked about skipping meals, which tends to be the pattern that I have, and relying on quick processed foods can lead to blood sugar spikes and crashes. These fluctuations can throw your hormones way out of whack, making it harder to regulate your menstrual cycle and maintain a healthy sperm count. Chronic stress. Stress raises cortisol, and high cortisol leads to insulin resistance, making it harder for your body to manage blood sugar. As we know, entrepreneurs often deal with high levels of stress, which can exacerbate blood sugar issues. Inconsistent sleep. This is a really interesting one. Sleep deprivation or irregular sleep patterns can also lead to blood sugar dysregulation. Lack of sleep impacts insulin sensitivity and hormone regulation, both of which are key for fertility. Here's the good news, guys. Balancing your blood sugar can significantly improve your fertility, and a functional approach can help. Let's talk about some simple but effective ways to manage your blood sugar levels. As I said earlier, don't skip meals. Eat regular meals, at least 3 meals per day. Try to keep a consistent time. And this is really challenging for someone like me whose body type wants to be all over the place. I want to do what I want to do when I want to do it, right? And most of you are probably just like me. So, making sure that meals are in your calendar, you're eating regular meals at regular times really helps to stabilize your blood sugar and insulin throughout the day and cause a lower release of cortisol so that your body is less stressed. How cool is that? Number two, eating balanced meals. Eating, focusing on eating a balanced meal with healthy fats, lean proteins, and fiber rich complex carbohydrates helps to stabilize blood sugar levels. Aim for regular meals and avoid long gaps between eating to prevent blood sugar crashes, and make sure your meals are high in protein and complex carbohydrates or fibers that help to stabilize your blood sugar when you eat. Reduce the processed sugar and refined carbs. Foods like sugary snacks, white bread, and pasta cause your blood sugar to spike that can wreak havoc on your hormone. Opt for whole complex carbohydrates like quinoa, whole brown rice, baked sweet potatoes. You can choose your favorite complex carbs, but the way to know if it's complex or processed is really simple. If it's in a bag, a box, or a can, it's probably processed and wasn't meant to eat. On the other hand, a complex carbohydrate is going to be as close to what came out of the ground. Brown rice, for example, has minimal processing to go through versus white rice, which is going to have more processing because it's white. Simple. So white rice is going to spike your blood sugar more than brown rice. It's kind of how it works, you guys. So if it came out of the ground that way, it's probably going to stabilize and support your blood sugar. And if it didn't come out of the ground that way, if something went through a processing, I've even seen like sweet potato chips. They take sweet potatoes and fry them. I'm sorry, guys, but that's processed. So that is going to have a very different reaction from eating a whole baked sweet potato that you would make for yourself. So think about it that way. If it's in a bag, a box, or a can, probably best to avoid it if you're trying to conceive. Stress management. Stress plays a huge role in blood sugar regulation, as we've already discussed. So, as always, techniques like meditation, yoga, or just deep breathing, which is my favorite exercise to recommend to people, it can help to reduce cortisol significantly and improve insulin sensitivity. Here's a little bonus for you guys. If you're not sure how to get started, because I know we talk about stress management so much on this channel. So if you're completely confused, there's a couple of things. One, I'm going to link to a video called Stress Rebalancing. That video is going to guide you through a mind body technique to help lower cortisol and lower stress in your body. The other thing, if you don't have time for that, that technique will take 30 seconds. But even if you don't have time for that, if you're in the middle of your day, you're like, I just need one thing that I can do without having to look it up, memorize it, whatever. Here's the thing, box breathing. It's my favorite technique. All you have to do is breathe in for 6 counts, hold for 6, out for 6, hold for 6. So it creates a box. Or square breathing, some people have called it. The idea is 6, 6, 6, 6. or you can do 5, 5, 5, 5, whatever works for you. And that technique will help regulate your cortisol, your blood sugar, so many things. Regular exercise can also help your body regulate insulin more effectively. Incorporating movement into your daily routine, even something as simple as walking, can make a huge difference in balancing blood sugar. Bonus tip, if you can walk after you eat, that has shown to improve blood sugar and insulin levels significantly just by a 10-minute walk followed by your meal. Your meal followed by a 10-minute walk is going to have a huge impact on stabilizing your blood sugar levels. Certain supplements like magnesium, chromium, and berberine are really great to help improve insulin sensitivity. That means helping your cells better respond to insulin to support blood sugar balance. And as always, if you're adding any new supplements, make sure you're consulting with a healthcare provider that understands supplements. Last but not least, making sure that you get 7 to 9 hours of high quality sleep every single night is going to make a huge difference in how you regulate your blood sugar. The crazy thing is, if you start journaling and writing down when you have crappy sleep, what you will notice, which most of my patients do, is that when you have crappy sleep or you didn't get enough sleep, more likely than not, it's going to connect with more processed food cravings the next day. So if you've been wondering why you're craving so many snacky things or ice cream or sugar or croissants, whatever it is, take your pick. Those things, all of your cravings will actually improve if you get adequate, high level, high quality sleep the night before. So, sleep deprivation directly impacts insulin sensitivity and blood sugar regulation. So, make sure you get enough rest. The key takeaway here is that blood sugar balance is essential for fertility. By making small changes to your diet, managing stress, and staying active, you can support your body's ability to ovulate regularly, improve sperm and egg quality, and increase your chances for conception as well as healthy pregnancy. As busy professionals, it's easy to neglect our health in the midst of career demands, your business, putting out all the fires that you're dealing with. I totally get it. I'm an entrepreneur myself, and I absolutely think that investing in fertility and overall health is worth the investment. So take the time to balance your blood sugar, and you'll see the benefits across the board in health, energy levels, even how well your brain functions is based on your blood sugar. So, absolutely crucial. And the best of all of these things are going to support your fertility. If you found this video useful, make sure to hit the like and subscribe button and share it with another woman just like you who is navigating her fertility journey. And if you have questions about blood sugar or fertility, feel free to drop me a DM on Instagram. I'm always here for you. I hope you have a really wonderful day, and I'll see you next time. Peace.